This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
And the theme of us holding patients, seeming never-ending holds in the emergency department, there was an interesting study that looked at the costs of holding in the emergency department. And basically the way this trial went down was they looked at patients who had strokes and they followed patients who were either admitted or held in the emergency department. And the way this particular study tried to figure out costs was to look at they basically followed the patients and saw the amount of time that nurses and providers spent with the patient. They knew the salaries for these people at this hospital, and they also looked at the overhead costs for either being in the ward, ICU, or the emergency department. And what they found was that for patients who were ward level patients, so floor patients who were held in the emergency department, the costs were about twice as much as if they were actually on the ward where they should have been. And they got less time from the providers and the nurses who were taking care of them. For ICU level patients who had strokes and were held in the ED, the costs were higher, but close to similar than if they were in the actual ICU, but they still had significantly less time being taken care of. So this was just one study looking at a big problem to show that the costs are more and the time that patients get is less. So I think we all know that it's not ideal for patients to be held in the emergency department when they should be admitted. So if anybody knows any administrators who can help fix this problem and, think we'll take this seriously. But, it's just one more piece that we know is not a good problem. And people are looking at it as a problem across the country. I think we have it pretty bad. So, all right. Well, thanks, everybody. Have a good morning.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.